Hello, I'm Dr. Shwetha Suvarna, lead consultant in Ayurveda's Sri Roga and Prasuti Tantra at AyurVAID hospitals. Let's talk about IVF and how Ayurveda can contribute to the success rate through IVF. IVF is an in vitro fertilization method, which is an assisted reproductive technique, which can improve the chances of conception for an infertile couple. However, there can be multiple factors that affects the success rate of IVF. So there can be multiple failures that a couple can see even when they are going through a IVF procedure. So the factors that can hamper the success rate of IVF majorly can be the substandard sperm and ovum, leading rise to a substandard embryo, fertilized embryo, which might not be able to thrive further. It can be the uterus, which is not receptive of the fertilized ovum and fails to implant and continue the pregnancy further. There can be multiple other reasons as well, but majorly these two are the reasons that end up in a IVF failure. So through Ayurveda, how can the chances of IVF success be promoted, and how we do that in Ayurveda hospitals? In Ayurveda, we have certain procedures like Panchakarma procedures and some lifestyle changes and diet changes, which can not only bring the good quality of sperm and ovum, but also can help in bringing the good health that can be transferred to the next generation. Because basically we can see most of the couples going through IVF would either have some predisposing conditions like diabetes mellitus, hypothyroidism, or n number of diseases that can be carried to the next generation. So going through a Panchakarma procedure will help you to see that you have had a healthy sperm and ovum, which can give rise to a healthy embryo, which improves the chance of conception as well as continuation of pregnancy. So how do we do that through the Panchakarma is, after a proper evaluation of the condition for what were the reasons of the failure for IVF, or even before you plan for IVF, you can go through this procedure, which can make sure that you have high chances of success through IVF. So what do we do is, a proper customized plan will be planned that based on the condition, which includes treatment procedures like Vamana, Virechana. Where when I say Vamana, it is a procedure of cleansing of the body. Same with Virechana. Nasya is to help promote the hormonal stability, and Basti procedures. And there are some specialized techniques called as Uttara Basti, which again promotes the quality of the IVF outcomes. So planned procedure followed with some diet changes, lifestyle changes, which brings in the health, not only the success rate but also brings in the health, and also make sure that the genetic coding is improved through the next generation. So these are all the benefits, and we have seen that couples who undergo Panchakarma treatment before their IVF has higher success rates in terms of the number of eggs that can be retrieved during egg retrieval, and also those eggs going into the different stages of embryo formation and continuing to implant and grow further to a full-term pregnancy. So there are high chances of success rate being improved through a Panchakarma procedure followed before a proper IVF procedure.